Welcome, everybody. Today we have two great speakers here on our conversation with the county. But before we move into the speakers, we're going to do an update as to what we are experiencing here in the county in general. But before we move into our presentation, I just want to take the time to take a deep breath. If you all can join me at the count of three and take a deep breath. 1, 2, 3. Thank you. I know some of us are moving on from helping with homework to preparing dinner during work hours, in between. So important to take a mindful pause to move on to our next item here. So let's go ahead and move into our presentation to give an update in our county in regards to COVID-19, our vaccines. So if we can move to the next slide. Just as we know, and we hear this over and over, but it's important to rinse and repeat. So I'm going to go ahead and go through them. Stay outdoors, continue to stay outdoors. Even though some of us might have the first and or the second doses of the vaccines, it's still important to stay outdoors. Stay masked, so continue to wear your mask. Maintain at least a 6 feet distance from others. Avoid crowds. Get vaccinated. And then this week, we opened up a new area for individuals eligible to receive vaccines in our county. So individuals ages 16 to 64 with high-risk conditions, including cancer, chronic kidney disease, stage 4 or above, chronic pulmonary disease, oxygen-dependent, Down syndrome, solid organ transplant with weakened immune system, pregnancy, sickle cell disease, heart failure, coronary artery disease, or cardiomyopathy, but not hypertension, severe obesity, and type 2 diabetes. And this list is subject to change in the coming weeks, but currently that's who we've added to the list of eligible people able to get the vaccine now. And as we know, workers in the food and agriculture departments, workers in education and childcare, emergency services workers who cannot practically work from home, and then residents ages 65 and older. And then just want to review the cases and vaccination rates by race and ethnicity. Some of you might have heard this, but it's important to understand that we continue to be those impacted the most by COVID-19. So when I say we, the Latino, Hispanic, Chicano, Mexican community, as we know, especially in the east side and Gilroy parts of our county, east side of San Jose and Gilroy, have been impacted the highest by COVID-19. And so if we see on the left the cases by race and ethnicity, we make approximately 25% of the population in the county. However, we make over 50% of the cases of the positive COVID-19 cases in the county. So just to repeat that, we only make approximately 25% of the population in our county, but we make over 50% of those being infected with COVID-19. So that's almost a double of those being affected with COVID-19. And so those numbers are high. Just pay attention. It's important to be mindful. And we know that there's many factors for this happening in our communities, right? Some of us share our homes with others, multi-generational homes. Some of us live with our grandparents, cousins, uncles, aunts, and families. Some of us are frontline workers. There's different factors, so we get it. And therefore, also, it's important to also acknowledge and find out what's happening in the vaccination rate as our vaccinations total we only make up 13% of those being vaccinated. So the total population of our Hispanic, Chicano, Latino, Mexican communities, there's 83% of our community that is not being vaccinated. Only 13% of our community is being vaccinated. So we need to be mindful. If we still haven't gotten our vaccine, make sure when it's our turn that we get signed up to get it, that we support our elders, that we support those that are now eligible to get it, to be able to walk them through that process. With Santa Clara County, we are having a call center as well that for now it's been bi-weekly for a couple of weeks now. And so we're going to be advertising that. Be on the lookout in our Facebook pages as to when we're going to have those call centers. So we will have somebody answering phone calls, walking people through the process of how to get a vaccination appointment. And it's also important to acknowledge that not everybody right now, there's not enough appointments. There's not enough vaccines available. Our county, unfortunately, has received less. So the allotment that we currently have, we are saving most of them for those who are getting their second vaccine. So those appointments aren't as available right now for the first doses of vaccine. But know that we're doing everything we can in order to get more. And so just a reminder in regards to the documents needed in order to get the vaccine. So you will be asked to sign a document under penalty of perjury, confirming that you meet the eligibility requirements, and bring a document showing that you are 65 or above, resident of a long-term care facility, that you live in Santa Clara, or that you are eligible because you work in healthcare, education, and childcare, emergency services, and food, agriculture. And now, as we just added, or a letter from the doctor saying that you fall under that new criteria that I just read earlier. And so the county also understands that some individuals do not have an updated photo ID, or might not have a pay stub or paperwork that might document this. So just look on our site for a list of other things that can help you. And if you don't have any, you will be asked to sign that document under the penalty of perjury, which should be sufficient to get your vaccine. And now, without further ado, I'd like to introduce our guests here today. We have Dr. Gerardo Solorio Cortez, who graduated from George Washington School of Medicine. He completed his residency in internal medicine at Santa Clara Valley Medical Center. He is currently the primary care physician at Valley Health Center in Gilroy, and is the current physician at the Gilroy High School vaccination site. His professional interests are decreasing barriers to access to healthcare, including vaccination rates in underserved communities. And we also have Julie Ramirez, who is manager in our current isolation and quarantine support program. She has been with the county since 2011, working on issues that impact women, girls, and families. First with the Office of the Women's Policy, and now as a senior management analyst at our Office of Gender-Based Violence Prevention and Division and Equity and Social Justice. Currently, as I mentioned, Julie is activated as a disaster service worker and is a manager of the Isolation and Quarantine Support Program. Welcome, Dr. Solorio Cortez and Julie Ramirez. And so what we'll do, just to guide you a little bit of our process, we're going to have Julie do a presentation as to some of the resources and services through her office, and then we will open it up for questions and answers with both of them here, or all three of us. So if you already or if you have some questions already in mind, feel free to start putting them and listing them. Otherwise, as we go, we will open it up for questions and answers towards the end of our event today. So welcome, Julie, and we'll go ahead and open it up to your presentation.
Thank you, Corina. Thank you. I really appreciate the opportunity to share this valuable resource with the community. This program, called the Isolation and Quarantine Support Program, is designed to help folks who have been diagnosed with COVID-19 or have been exposed to COVID-19 and they've been told they need to stay home. So the county, along with some participating cities in the county, recognize that that's not easy to do. So that's why this program has come to fruition. So today, I just want to briefly tell you a little bit more about the program. I want to tell you the services that we offer, who's eligible, and how you can apply. Next slide. Go ahead and go to the next slide, please. So what is the Isolation and Quarantine Support Program? Well, we provide these services to help you stay home if you test positive or if you're exposed. We provide financial or rental assistance. We provide grocery delivery or supply delivery to your home if you are isolating or quarantining. Or if you find that you don't have a place to safely isolate or quarantine, then we can provide you with a hotel placement. Next slide. So who's eligible for this survey, this service? Anyone who not only has been positive or has had that exposure, but has lost income as a result of that. In other words, you weren't able to work. If you weren't able to work because you were sick, then you may you'll meet the first criteria. You also have to be a resident in Santa Clara County and in one of the participating cities that I'll review shortly. And then this program is designed for families who have the total family income at or below 80% AMI. So it's designed for low income families. I do want to emphasize, however, that all residents who are experiencing homelessness are eligible for this program. And all persons residing in unincorporated Santa Clara County are eligible for this program. And the immigration status of an individual does not matter. We do not ask that. Next slide. Here are the participating cities. So you can see that there are several cities within the county that offer all three of those services that I discussed previously. And there are some cities within the county that only offer hotel, for example. Gilroy is one of them. If you were unsure whether or not your city qualifies, I would recommend that you just call our hotline and then we'll discuss these eligibility factors with you. Next slide. Let me talk a little bit about the financial and rental assistance and what's the difference. They both mean that you will receive cash to take care of your basic needs. However, with the financial assistance, you would qualify for $2,000 for one individual. If there are two income earners in your family that meet the criteria that I discussed, then the maximum that we can help you with is $2,500. And the client can spend this money on any necessities that they deem fit. On the other hand, if your need is specific to rental assistance, and we all know how expensive that is, a person may qualify for assistance up to $5,000 for 1 month rent and utilities. This check, though, goes directly to the landlord, not the client. And we require some documentation from the landlord, such as the W-9. The process is a little lengthier. It requires a little bit more documentation, for example, a lease agreement on behalf of the client. But because of the increased dollar amount that you may qualify for, this might be the right path for you if you need that extra subsidy. Clients are allowed to email or text their documents. And we want to emphasize that the income that you get if as part of this program is not taxable. It does not have to be recorded on your income tax return, and you don't have to pay it back. So again, the county recognizes that this is a crisis and they're there to help our residents get through it. And one means is through financial or rental assistance. Next slide. Quickly, what are the documents that you might need to supply if you want to receive assistance? We tried to streamline it and make it as accessible as possible, very similar to the vaccines like Corina was describing earlier. We require a type of identification, one photo ID, one that shows that your address is within Santa Clara County. However, if your ID does not show that you have a residence in Santa Clara County, show us in another way. So like a bill would be an acceptable form of that identification. If, in addition, we need to understand that you have lost income as a result of your circumstance and COVID diagnosis or exposure. So we will accept a self-certification that is signed and dated by yourself. And in fact, we will provide a template to make it simpler for our residents to do that. Next slide. One question that we always get asked is this assistance limited to one house or multiple households? And there's a difference, right? We understand that in Silicon Valley, we are in a housing crisis among all the other challenges that we face, and multiple families live within one dwelling. So it is possible for multiple families who reside at one address to both qualify. However, they need to each meet those qualifying eligibility factors that I described earlier. And we will discuss this one-on-one with the client in very detailed manner to decipher whether it is one household or two households. But I do want to make it clear that if multiple families live in one house, it is possible for all of them to receive the help. Next slide. How long will it take for you to get assistance? Well, once you submit your application, we have a staff of more than 50 IQ coordinators who will, one of them will respond to you within 24 hours. They will call if you leave a phone number, email, call, even text to figure out a time for you all to communicate in real time. And they'll give at least 3 attempts before they close the case. If your case is closed because you somehow missed maybe you're sick, for example, maybe you weren't up to talking and they called you and you just couldn't get the energy to take that phone call, you may call us back when you're feeling better and we'll reopen your case. And in the end, the client will receive assistance within 7 to 10 days. So that's our goal. Next slide. How do you get a hold of us? Well, we have a hotline number that is staffed 7 days a week from 8 a.m. to 6 p.m. If you call after hours, you may leave a recording in any language that you are comfortable in. We have a very diverse staff, and in addition, we have the ability to connect with a language line. So you can leave a message and we will speak to you in your preferred language. There's an additional hotline that is for homeless residents that may need support ongoing, and that's what we call the JDOC hotline. It's a joint operations center, and that hotline is below, and it's just an additional resource. Right now, what I'm talking about is the one on the top, the 408-808-7770. That is the hotline to the Santa Clara County Isolation and Quarantine Support Program. Next slide. If you call us and we determine that unfortunately you are not eligible for our program, we will do our best to connect you with other resources. And in fact, these resources are available on the county resource on the county website for you to explore and study as well, and determine what needs you may be able to get assisted with and what resources are out there. So I just wanted to promote the COVID-19 resource directory on the county website. And if you go to sccgov.org and search resource directory, you will find it, or there's a specific link at the bottom of the slide if you can take time to make note of that longer URL. And lastly, gets on the next slide, please. Lastly, this is just our information. My name is on there. I am one of 4 managers for the program that is there to oversee the activity. We have a staff of more than 50 INQ coordinators who are there to talk directly with the community, make sure that you're getting the needs that your needs met during the difficult time of either being COVID positive are being exposed and being challenged, facing those challenges of financial or rental crises. We're here to help. Corina?
Great. Thank you so much, Julie, for all that information. And we look forward to having you be available to answer any questions that the community might have. And so with that, without further ado, I'll go ahead and open it up. Like I mentioned, we do have Dr. Gerardo Solorio Cortez here as well, helping answer specific questions around the vaccinations. And then you heard Julie Ramirez in her wonderful presentation about the specific resources around isolation and quarantine here in our county. So we're going to go ahead and move over to our questions and answer period. And I'm just going to go down the list as I see them. I'm going to go ahead and start with Yael Serbar. And the question is, we hear many eligible people hunting for vaccines and need to drive far counties like Moscone Center. What's happening with Santa Clara's stock? So as I mentioned earlier, unfortunately, we got a lower stock and in this period, and really things can change on a daily basis, sometimes hourly. And so currently our stock as a county has been less. So we are saving the first vaccines to those that are getting their second dose. So we're not opening up for first vaccines right now. And we're also directing those that have other insurance, such as Kaiser. We're directing those to go to Kaiser, so on and so forth, to their other insurances, so that they can get vaccinated. So unfortunately, we haven't received as many vaccines as we wanted. Again, you know, they're provided to us from the state, and so they are going. My understanding is that they're going to other counties that, quote unquote, needed that number the most. And then Dr. Solorio Cortez, I don't know if there's anything you'd like to add to that.
No, I mean, I pretty much, frustration of our, community members, and it's pretty much just a wait and see what the state, or federal government sends us, and it's pretty much a weekly waiting, the waiting game, and see what we get, how many vaccines, and then what types. So it's pretty much that, and I fully understand the frustration, and I'll just say, hang in there. I mean, just reading the news and listening to the politicians, President Biden, it sounds like they want to ramp up more as we move forward into the months of late March, April. So I just keep the hope of that they do increase the amount.
Mm-hmm. Thank you. And then we have Lori Reynois, who mentions heart conditions. So I'm assuming, I think it was right after the presentation that I listed heart conditions.
Yeah,
and yes.
It's a very good. I'll take this question.
Yeah, thank you.
I mean, pretty much by heart conditions, they mean cardiac disease, cardiomyopathy, meaning like heart failure. So if your doctor or provider has told you that you have that condition, again, going back to congestive heart failure or cardiac myopathy, muscle disease of the heart, then by definition, you do meet criteria on this tier.
Thank you. And then we have from Michelle Watson, who also asked what is going on with the vaccine supply. I think we just answered. Thank you so much. Steve Shepard says San Francisco has widened the BMI eligibility to less than 30 and San Diego to less than 25. Does Santa Clara County plan to widen the eligibility?
I mean, so I don't know the details, but I think it's a good question to ask. Our public health officials to see if we could do that. I think it's a valid question.
Mm-hmm. Yes. I haven't heard the answer to that specific question, but that is a good question. And then we have Brenda DeBrum Grims, who asks, when are we getting vaccine? So might be from the answers that we gave earlier. We're hoping soon. Or where can we get them? Lori Ann Segovia asks, where can we get them? I can answer that, Dr. Solorio Cortez. So we have various places throughout the county. I know, for example, Dr. Solorio Cortez is stationed at Gilroy High School. And in Gilroy, that's one of the places where you can access the vaccine. I know here in San Jose, for example, we have our Emmanuel Baptist Church who's providing vaccines. We also recently opened up the Eastridge on the roller rink skating location there. So there's different locations throughout. We also have some mobile sites that are mobile in the community. And so there is a list on our website, but we're also being mindful of the lack of vaccines that we have right now as well. So we want to make sure that when we make an announcement that we have enough vaccines to meet the need. And so know that those might change day to day, and the announcements will go out, or if you show up for some of the ones that we're walking, you might find a sign at the door that says no vaccines available today. So just be mindful of that. We get to be patient, but know that as leaders, I know that they're being very vocal in making sure that we get what we need here in Santa Clara County.
And
Anything you want to add? Mm-hmm.
I would just add that healthcare systems like Kaiser or even Stanford, they'll and us too, Santa Clara Valley Medical Center, our health and county system, their patient portal systems, their patients are being sent messages when they meet criteria for that tier. So I would say pay attention to those messages if you get them on your patient portal. I would also encourage you to maybe have a talk with your healthcare provider and see if they or if they have any leads on where to go, how to get signed up. And of course the websites that we have through the county is, I think, the best place where you could go for the latest information on if you meet criteria for the vaccine.
Mm-hmm. Thank you. We have Lori Reynolds who asks, Latino home cleaners living on the east side of San Jose, I'm assuming if they're eligible to get the vaccine. And if it's not that question, please continue to put your question and put it the right way. So right now, as far as I know, as a public information officer, is not yet, as they're not essential employees. And so, as we know, some are lucky enough to have people cleaning their homes, and but it's not an essential. And so I don't think they fall under that category yet. Dr. Solorio Cortez, is that your understanding as well?
I agree with you. I agree.
Okay. Thank you. We have Whitney Kim Law who asks, how often does a county get a new shipment of vaccine doses? And I think we've answered that. Right now it's day to day, sometimes hour to hour. Okay, we have Steve Shepard who asks, what specifically is Santa Clara County doing to get an adequate supply of vaccines? Anything you want to add to that, Dr. Solorio Cortez?
Not specifically. I think it's a higher level, you know, issue, and the solution to that is, I think it takes a lot of stakeholders on the level of the executive and supervisors and leaders.
Yeah, and the only thing I'll add to that is I know that Cindy Chavez held a press conference last week on Thursday, getting again the different leaders together and demanding that we are able to keep the control of our vaccines as we've been doing a good job here in Santa Clara County. But yeah, there's a lot of moving parts to that. And so, yes, our leaders, we get to continue to be vocal as to what we need here in Santa Clara County. So join the support.
Yeah.
We have Lenny San who says, when will below 65 to 50 get the vaccine?
Well, I think the question means like no health issues and 50 to 65. So, I mean, we're still at the tier of people with conditions, 18 to 65. So, I mean, I don't know. I mean, and it's going back to the supplies, and also, basing on the recent President Biden, address. So, I'm being hopeful that next month, being April, there'll be a high upswing of supply. That's basically it.
Mm-hmm. Thank you. Okay, and then we have Jody who's saying, short of second dose vaccine, friend got denied appointment canceled last week because they were short of supply. Yes. Okay, let's go down. Okay. There are no Santa Clara County zip codes in the lowest quartile of the Healthy Places Index. Do you consider this to be equitable? If so, why? If not, what is being done to address this? And I have my thoughts. I don't know if any one of you want to answer this.
I mean, I think you kind of answered it with Supervisor Chavez and our leaders, trying to meet, I believe, with Governor Newsom and the suppliers, just to ask that question and see if there's any other ways that we could get the supply, because and the question is right, it leaves people out, and I think our leaders have stood up and asked that question, and I think working with the governor, trying to come up with a solution that's going to benefit us.
Thank you. And then we have, are you sure about unincorporated? How does that follow state guidelines? And I'm not sure. Did anybody, Julie, did you mention unincorporated in your presentation? So I think that was to you.
I did, Eric. I was specifically referencing the eligibility criteria for the isolation and quarantine support program. This is separate from vaccinations. Our program provides services including motel placement, grocery delivery, and also financial assistance to those who have either been diagnosed with COVID or have had an exposure and been told to quarantine. Anybody in unincorporated Santa Clara County qualifies for those services. And the hotline is on the screen. If you are in need of assistance because you've been impacted negatively by COVID, lost income, or a resident within unincorporated Santa Clara County, please give us a call, and we will, we've got coordinators on standby who can assist with your application.
Thank you, Julie. And we have Irma Navarro who asks, my son has Kaiser and he was able to get the vaccine the next day in San Jose using their online site. Sorry, she's informing us. Thank you, Irma.
Yeah, thank you.
And then we have Steve Shepard who asks, is the county's refusal to sign the Blue Shield contract affecting the vaccine supply? and I can respond with no, we don't think so, and what we know is that other zip codes who have higher need is how it's affecting our vaccine dosages. Do you know? Yeah, is that what you understand too, Dr. Solorio Cortez?
Agree with you. Pretty much agree with them.
Mm-hmm. Okay, Red House Raquel asks, is it required to have Kaiser Health insurance or is it open to the public? So I'm assuming she's asking the person who says that they got a vaccine. So Kaiser will vaccinate Kaiser patients.
Right.
County is open to everyone, but unfortunately right now they're only vaccinating, counties vaccinating the second dose, making those a priority. Thank you, Irma, for that information. We have Lee Ann Tanner, who says, now it's anyone that no wrong door policy to get the vaccine from any provider. I'm assuming she's referring to our no wrong door and is wondering if we are following that. Unfortunately, at this time, again, because of the number of vaccines, we are prioritizing those that are getting their second dose. Dr. Solorio Cortez, do you want to add to that?
Nothing to add.
Thank you. We have Kevin Gaitan Baez. Eric Sanji, can you clarify your question? Per state law, county government is responsible for serving unincorporated areas. Thus, this program should especially serve unincorporated areas since the county is responsible for those areas. And you helped answer that, Julie. Thank you. Anything you want to add before we move on from that?
Kevin is one of our IQ support coordinators and is very knowledgeable. And should anybody call and get connected with Kevin, he's a great resource and a very kind person.
Nice. And I'm going to go to the questions. Let's see. Eric Sanji, I heard the presenter say that all residents of unincorporated areas were eligible. Do they mean that they have the same eligibility as those who live in the unincorporated? Okay, I know we've answered that. And I think we made it pretty clear. Thank you. Let's see. I'm going to the questions. Lenny San asks, how come some young adults without any health problems get the vaccine when they accompany their elderly family? Mr. Solorio Cortez.
It's more of the definition of a caregiver. So if family member, mom and dad, go for the vaccine, and son, daughter, or grandson, granddaughter is the primary, caregiver, then by that definition would meet criteria of a healthcare provider, caregiver. It's not set in stone that, again, we go back to signing up and signing or clicking the box that you do meet criteria for that tier, and by you being a caregiver for that family member, we do want to protect you too as well with the vaccine, so you will meet criteria under that.
Thank you. And we have Yi Chen who's saying, I will be 65 years old next month. Where shall I get shot of COVID-19 vaccines in Milpitas, Santa Clara County? So I'll just repeat that unfortunately right now we're not taking first dose, and hopefully that changes soon. So right now, unfortunately, there's nowhere. Well, I wouldn't say nowhere, but if you're a Kaiser patient, then you can make an appointment with Kaiser or a private insurance provider. Definitely contact your private insurance provider. Otherwise, to Santa Clara County, we are waiting for more vaccines to do the first dose. And we're prioritizing the second dose at this time. We have Maribel who is asking for Español, por favor. And I'll just tell her in Spanish real quick. Margarita, a las 7 de la noche tendremos esta misma información en nuestro canal de español. So at 7 p.m. tonight, if any of you have any Spanish speakers in your families or community, please let them know. We'll have the same presentation on our Spanish Facebook channel. Lee Ann Tanner, do we know the reasons for why we are not getting the vaccine supply? No. Well, we mentioned it already. Again, we understand that certain zip codes who have higher need are the ones getting vaccines. Gabriel Martinez, I am a liver transplant recipient. Is it safe to get the vaccine, doctor?
That's a very excellent question. I would advise you to talk to your healthcare provider, be it primary care doc or the doctor who's following the transplant. But in general, as a general statement, you should be able to get the vaccine. When it comes to medications or treatments that suppress your immune system, or basically saying that lowers down your immune system, I think we're more worried about active, like chemotherapy treatments. So in those situations, we highly encourage you to speak to your oncologist to make sure that it is okay to get the vaccine. But as a blanket statement, almost everyone who has a transplant should be able to get the vaccine, be it Moderna, Pfizer, or Johnson and Johnson, and also making sure that then there's no allergies to the products in those vaccines. And even so, let me step back. People that have severe allergies to, let's say, nuts, bees, that doesn't disqualify you for a vaccine. Vaccine pretty much it just means that instead of observing you for 15 minutes, we're going to observe you for 30 minutes as an add-on to the question. Just going back to the fact that we believe that all three vaccines are safe and effective in a wide range of patient population, including individuals such as yourself with organ transplant.
Great, thank you so much. And then we have Red House Raquel. I'm not sure what IHS stands for, so I'm going to ask her if she can, because I have my own thoughts of what that stands for, but I want to make sure that I'm understanding her question. Red House Raquel, if you can put in what IHS stands for, and then we'll go ahead and come back and answer your question if you can put it on the comments. Lori Reynolds, my husband is being treated for AFib. Is that qualifying, doctor?
I want to say yes, only because most of the time, or many of the times, atrial fibrillation is associated with cardiomyopathy, the heart disease that we had mentioned previously. So again, going back to encourage you to talk to your healthcare provider, but it sounds like it could be. And again, it gets very detailed. And I would say, a lot of this is going to be like, slam dunk. It is what it is on the diagnosis, but there are going to be gray areas with certain conditions. So definitely encourage you to speak to your doctor.
Great, thank you. And then we have Kirk Vartan, who is asking, why is the county suggesting to get a COVID test after being vaccinated? Doctor?
As I'm aware, I don't think I haven't. I'm one of the physician reviewers at our Gilroy Center, and I could attest, tell you that we're not telling our people that we would vaccinate to be tested 1 day, 2 days, 3 days after. I mean, so the answer is no. Yes, if a person has symptoms, and this comes for everyone, symptoms consistent with COVID should alert the healthcare provider to get tested for COVID. People that have been vaccinated, it's less likely. Again, that's the whole purpose, and what we're saying. It's so efficient, it's so protective that very unlikely that a vaccinated person is going to develop COVID, but it could happen. So I go back to the fact that if any symptoms are present of COVID, then you should be tested. But getting the vaccine doesn't mean that we're recommended to be tested. No, so that's not the truth.
Thank you. And we have Sonia Tetnowski here, who is the director of the Indian Health Center, which I thought might be the organization the previous person was asking. So I'm glad she's there to answer. Thank you, Sonia, for being here and helping answer that question. Red House Raquel, I hope that we are taking the time to acknowledge your question and your needs. So please feel free, if it's not Indian Health Center, then that you put it in there so we can take the time to answer that. Thank you. Lee Ann Tanner says thanks.
Farina,
Yes.
let me just add on. For the question about getting tested again, I was talking more about if you have symptoms, but me as a healthcare provider, doctor, vaccinated, did all that, but we're still as healthcare providers, and it goes back to where I was saying that it's not 100%, and it almost is there. It could happen for that reason, and for us being close to patients, we're still being tested that's a recommendation, to be tested every 2 weeks. So I think it's a follow up to the question. I think that individual was asking, get vaccinated. I'm a healthcare provider. Do I still need to be tested? And for asymptomatic transmission and such, for example, in the county, we do employees still get tested, and it's for safety again, because the studies, although the Johnson & Johnson does show a little bit more information on the stoppage of transmission asymptomatically, meaning having no symptoms, that it's going to be helpful. We don't have the same data for Moderna, Pfizer. That's coming out, I would say, in the next few months or weeks, and it's for that reason that the CDC still recommends that we wear a mask, because of the asymptomatic transmission possibility. Yeah, CDC, and I don't want to confuse people. CDC did say that you're able to take off your mask if you're around someone that's already been vaccinated as well, but in only one household. But in general, masks are still being even after vaccination when you are in public. And so yeah, I will leave it as that at that.
Thank you. We have Kaitlin Courtney, who's asking, what will Santa Clara County prioritize critical manufacturing soon? We know Solano County has prioritized this group. Yeah, we don't know exactly when the next group will be prioritized, or when we'll move on to the next group. I also I see a question down here from Rosemary Porras, who's asking about her husband, who's an electrician. Unfortunately, we don't have an exact timeline as to when those groups will be eligible at this time. We have Carl Povry, who says New York and New Jersey have given vaccines to so many younger folks. Why are we so slow? Doctor, do you have anything?
No, I mean, I think it boils down to the supply. It's supply and where we're getting, and as you mentioned, it's a pretty much day by day, week by week update when we get the supply.
Also, Dr. Solorio Cortez, just in regards to the children, I understand that some vaccines are also getting tested to make sure that they're safe for children. Is that true? That might be slowing down maybe the amount that we're getting, or as fast. I know we all want our children vaccinated, but maybe
I don't. I think that's a separate and I'm excited about it. It's a separate issue in terms of the studies with Moderna and Pfizer. Those are being done, but that's I don't think that would halt the supply. I think it's more of the the making the products that and the processes of who gets what, again, going back to the zip codes, what zip codes get it, what counties get it, what states get it. I mean, I understand totally the question about there's inequities or differences in allocation by state in the US. So it's a valid question of like why is it? And I don't going back to I mean, I wish I had the answer, but I think as you mentioned before too, so many moving parts, and I think and I have a lot of confidence in our supervisors and executives that we're doing our best to be equal to other states.
Mhm. Thank you. And I see Raquel, Red House Raquel came back, and she's referring to the Indian Health Services, which Sonia did put on here. If yes, then Indian Health Center of Santa Clara Valley can support the American Indian and Alaskan Native in Santa Clara County. Please feel free to reach out to us. So if you fall under that category, feel free to reach out to the Indian Health Center. Thank you all out there doing such a great job. And that's the center that I thought she was talking about, but I didn't want to make any assumptions. So thank you, Red House Raquel, for confirming that. Josette Madriz, In Hope Support Services might be, and I think it got cut off. We'll move on to the next one. We have Yi Chen. Why did these people get first dose of COVID-19 vaccine to get second dose? If they have first dose, then they are able to produce some antibodies already to protect them? Dr. Solorio Cortez?
You're right. I mean, that's a very good question. I mean, you're making antibodies, after the first dose of Moderna, Pfizer, and again also Johnson & Johnson. So, for example, Moderna, Pfizer, after 1 month after the first dose, you're at, like the studies do show that it's like 70% effectiveness, and after your second dose, 2 weeks after, you're at 95%. So it's a valid question. Like, well, if you're 70%, why not just do the first dose, Moderna, Pfizer, get the 70%, you're protected, and then wait 2 weeks, 3 weeks later for your other dose, but your second dose allows it to another person who's 0%. It's a valid point. And I think even scientists, are there's studies coming out. There's discussion, debate. You got top-notch researchers at Harvard, Yale, UCSF who'll get down and talk about this. And also because COVID-19 is such an it's new. It's changed things. So with it also comes as you mentioned, Karina, it's a day-by-day thing that we're in, and we as leaders have to figure out what's the best thing to do. So even though, and I know I went all around in circles, but getting to the point that even knowing you're 70%, the studies, CDC still recommends that you need your second dose to be at 95%. And for that reason, we're going to vaccinate those that need the second dose at that point, and not use that second dose for a first dose, because it's going against what the CDC and the FDA recommended when it was approved. Definitely, if things are getting worse with supply, I have faith in our leaders, and going back to Dr. Fauci and figuring out, well, okay, is it okay? Do studies have studies told us definitively that we could get away with just doing one vaccine for now, just to vaccinate other individuals? Then that'll be the case in the future if studies do show that. But at this point, we cannot say that. We got to do the second dose. And unfortunately, you're right, and it leaves people out until we get more supply. But it's a very excellent question that even you'll find esteemed infectious diseases people and doctors who will make that argument as well. Why not just give one dose and then wait until we get more supply, so that we're all at 70%? But it's not the case.
Thank you so much. And I'm going to try to get through all the questions. I don't know if we will, but know that we're doing our best. So I see, do you have any forecast to the county moving into orange tier? Will this impact vaccination process? So do we have forecasts? We do. We see our numbers, as a county getting better. And so that's great. Do I have a timeline? No, because again, just like we saw a year ago, right? The numbers can change moment to moment. So, but hopefully we're moving in the right direction as a county. And will it impact the vaccination process? That won't. unfortunately, we are waiting for the number of vaccines coming down and provided to us at this time. So Arlene Rodriguez says, when a person gets the first dose, do they have to go back to the same place to get the second dose? That same place does not have any appointments.
It's a very good question. I think the general, very good point in terms of like, can I get Moderna now? And, I go for my second dose and, that place has Pfizer. Can I do Pfizer? No, you can't mix them up. But if you go to one place with Moderna and Gilroy, and in 1 month you're set up for your 28th, after 28 days, you have your second dose set up at Levi Stadium, and it's a Moderna, that's very allowable. Just recently in Gilroy, I had a patient who had the first dose in Hawaii for a Moderna, and we gave that individual the Moderna here in Gilroy. So as long as you keep it the same series, meaning the same type, you're good.
Okay, thank you. What is the protocol for no-show appointments to ensure there are no wasted vaccines? So right now, I know that, I don't know, Dr. Solorio Cortez, what is it there at your site?
Well, pretty much right now, it's like it's all second doses. So for the most part, people are showing up. It is their second dose, and there are no first time, first shot appointments. So the no-show rate is pretty low right now because they're all second doses.
Yeah, thank you. And we have Monica Lynn and a couple of others who are responding to her. There are many 16 to 17-year-olds working at high traffic fast food restaurants and other food services. They should be eligible to get the vaccine now. Are they, Dr. Solorio Cortez?
As long as you fit the tier, and we're talking about Pfizer, again, very important. Pfizer is the only one that's 16 and above. The other two, Moderna and Johnson & Johnson, are 18 and above. So that's a very it's a very good question, and it gets to the details of who could, who's in that tier and which vaccine will be most appropriate.
Great. And so I see the last question here, and we've then gone through them all. Is there a way to check whether the sites are doing Moderna or Pfizer? And there's not, because as we get the allotments, we're getting them out. Dr. Solorio, anything different on that?
No, nothing to add. I agree with.
Okay, and so thank you all so much for joining us today. Dr. Gerardo Solorio Cortez, hope you had some water there because I know you were answering many of them. Julie Ramirez, thank you so much for your presentation, the resources that your organization, your team is providing that are much needed. And so thank you both for what you do for our communities, especially those that are highest impacted. And I look forward to continuing to serve the community along your side. Thank you so much for joining, everyone.
Thank you, everyone.
Thank you. My pleasure.